everyone. Today we're going to work down the muscle chain into the muscles of the neck. So we're going to focus on three areas. So the base of the skull, the sternocleidomastoid muscle, or SCM for short, and the scalene muscle. So they're on either side. Some of the symptoms of tight neck muscles can be headaches, dizziness, blurred vision, pain into the shoulder blade, pain into your fingers or your forearm as well. So just with these pressure points, what you want is just enough pressure. You don't need to go too hard, so just enough pressure that you feel the point and that you can also feel a release happening. So starting off with the muscles at the back of the neck and that attach onto that occipital ridge. So you're going to bring your two thumbs like so, and you're going to bring it into the back of that ridge at the base of the skull. And what kind of movement you want is an in and upwards pressure into that ridge. So bringing your hands around, starting right in the midline and coming in and up, and then working your way towards the outside. So if you want, you can start off with a very, very light pressure and do sort of 2 lines just to get the muscles used to your touch, and then come back after your second time and go a little bit deeper. And so always moving from in to out, and just hold on a spot that's particularly tender for 30 seconds to a minute until you feel it releasing. This area is very, very sensitive, so you will feel referral patterns into the front of the head. You may feel a little bit nauseous as well, so if you do feel that, just ease off your pressure. Another way of getting this muscle is to grab a chair that has sort of a top like this, and then you're going to slouch down into the back of the chair, bringing the ridge to the base of the skull. So you won't get that same in and up pressure, but you will get a release onto the muscles of the base of the skull. And what you can do is just gently roll the neck from side to side. So starting off on the left and gently coming around, holding on a spot that's particularly tender, and then moving on to the next point once you start to feel it release. If that's still a little bit too much for you, just pop a little towel or a face cloth on top of this, and that will give it just a little bit more sponginess to give less pressure. Next, what we're going to do is we're going to move on to the front of the neck muscles, so the SCM and your scalene muscles. So these are accessory muscles to breathing as well, so they're going to have an effect on the respiratory system. Some of the pain points or pressure points that you will feel are going to affect the eyes, the ears, and they also will have an effect on the nasal sinuses as well. So again, just be mindful of the pressure that you're using. So how we're going to find our SCM, so we have one on each side, the same as the scalene muscles. So you're going to rotate your neck, and what you can do is then you can also pop a little bit of pressure and you'll see this muscle popping out. So once you find that muscle, you just bring your neck back into the midline, and you can see that you have it in between your thumb and your finger. You can use the hand of the same side, or you can use the opposite hand as well. So coming around and pinching that muscle. So it attaches onto the collarbone and also onto the bony process here called your mastoid process. So you want to start down at the bottom as close as you can to the collarbone, and then work your way up, pinching either side, and then holding again until you feel that release, and then moving up onto the next spot. So just when you are on this area, if you feel your pulse, you're on the carotid artery, so you want to move back, so you don't want to feel it, the pulse at all. So if you do feel it, just move back, and we're not going to be moving onto any or working anything at the front of the SCM, so everything is going to be on the SCM and behind. So you want to work the belly of the muscle all the way up to that mastoid process. You can put a little pressure then on that mastoid process as well, and then coming down onto the clavicle. So onto that collarbone, finding that corner, and then just coming up onto the top and putting pressure down onto the collarbone. This area actually might be the most tender, so if it is, just come off a little bit and then put a little bit of pressure on and breathe into it. Again, as I said, these are accessory muscles to breathing, so all our breath is going to do is help with that release as well. So once you finish one side, you're going to move up onto the other side, exactly finding the same point. Then we're going to move on to our scalene muscles. So here, once you found your SCM, so we're going to move in behind it. So once you've found a point, you'll feel it straight away once you come onto it. You just move your head into the midline again and working our way up. So you can use 2 fingers, you can use 3 fingers, whatever suits you better. So just so you can see that we're on the side here. So I can feel a point now running down into the back of my shoulder blade. So I'll hold until I find the release. And then once I've found it, I move on to the next point. As I mentioned, it can affect the eyes as well. So what we want to do is bring our breathing and our eye movement in to help a release as well. So when we take a deep breath in, we want to move our eye muscles down. So not our head in flexion, but just our eye muscles. So these gentle eye movements help contract and relax the muscles subtly. So holding on to your point, take a deep breath in and bringing our eye movement down. And exhale, bringing our eye movement up then. And what you'll find is you'll find a little bit more release, or you'll find a little bit more tension in that muscle. So do that 2 to 3 times then. So inhale, looking down, and exhale, looking up, again just with the eye movements. Once you've finished one side, so you're moving up and down, you pop onto the opposite side again. So we have 2 pairs, so 1 on either side of these muscles. Again, just be mindful of your pressure, so you want just enough, so you don't want to go too hard. Any nausea or dizziness, come off the point and just really do a much gentler pressure. If you have any questions at all, just leave a comment in the comment section and I will get back to you as soon as I can. Hope these all work for you and you find some relief.